Women have for a long time borne the burden of most family planning methods, some of which have caused negative side effects on their health. However, that is gradually changing, with some men now opting for vasectomy. Our reporter Christine Muchira met Richard Kilundo, one of the two men in Kwale County who underwent vasectomy this year. He attributed to her that misconceptions about the procedure are just that, fear of the unknown.
Imagine living in a society where the man takes the lead role in planning his family in the literal sense. This is the story of the changing face of family planning in Kwale County, where Richard Kilundo, a 55-year-old nursing officer and a father of three, made a personal choice to undergo vasectomy.
After my firstborn had a kid, and I thought, now this is not the right time for me to have a kid. That kid that I will have after my firstborn, my first grandson or granddaughter, na mimi nipate mtoto baadaye, alafu anakuja kuita ndugu yake, anakuja kuita mjomba wake ama nani yake na ni mdogo kumliko, nikaona hiyo haiendi sawa.
Vasectomy is a simple outpatient surgical procedure that provides permanent contraception for men.
There is a local infiltration that is being done to the site. It is a scalpelless. You don't need to make an incision. Then it is being identified, pulled up by a specific instrument that is found in a vasectomy set. Then it is being ligated from both sides. Once you ligate both sides, you cut. So once you cut, you return it and you leave it like that.
Mimi nilifanyiwa na nilitoka hapo na nikaenda shambani straight.
Kilundo's decision was met with mixed reactions, including skepticism from some men who associate vasectomy with loss of masculinity.
Some men have spoken and said, how will be my performance? You know, my sexual performance, will it be affected by the fact that I have had a vasectomy done on me?
Hakuna nguvu za kiume ambayo inapungua. Hakuna. Kwanza unakuwa hata unaifanya bila wasiwasi wote kwa sababu unajua hakuna mimba hapa tunategemea.
Dr. Matano Kibwana, the medical superintendent at Kilifi County and Referral Hospital, has called on male involvement in maternal health, noting that cultural and societal norms have historically excluded men from the pregnancy and delivery process, but Kibwana says his team is determined to change that.
What we are trying to do is to have more involvement of the male partner, not only in the delivery process, but right from antenatal care. They need to understand what their partners are going through, the pregnancy process, and in that, they will be able to understand more, be more engaged in matters, knowing whether this person needs to rest. My child needs to be breastfed for 2 successive years so that you do not get a mother having deliveries back to back.
Dr. Kibwana noted that through partnerships and outreach programs implemented by the International Center for Reproductive Health, UNFPA has worked to increase access to family planning services in the county.
We cannot work alone. We need to work with the different partners that we have. For example, UNFPA has really helped us in matters support in maternal and child health. They've really supported us in that, and so as to push us to better care for our mothers and children.
According to the United Nations Population Fund, the percentage of married women using modern contraceptives has steadily increased over time, from 32% in 2003 to 57% in 2022. Over the same period, the unmet need for family planning declined from 27% to 14%. Kenya aims to achieve 64% of modern contraceptive prevalence rate by 2030. UNFPA is working to address barriers to accessing family planning by ensuring a steady, reliable supply of quality contraceptives, strengthening the supply chain management system, and strengthening health workers' capacity to provide services, particularly long-acting and permanent family planning methods. In partnership with UNFPA, Kenya Medical Supplies Authority has reduced stockouts in health facilities from 15% to 3% by leveraging on technology dubbed Integrated Logistics Information Systems, which ensures timely delivery of medical supplies, particularly family planning, to healthcare facilities across the country. Christine Muchira reporting for KBC Channel 1 News.